I have, over the last number of years, been doing quite a bit of research on cancer. And what I'm really excited about and really passionate about is when I have people come in who have various cancers, I'd like them to understand what it is they're actually dealing with. In fact, the tumor is not the cancer. And when people come in, they're focused on the lump. And when oncologists see them, the oncologists are focused on the lump because that's what oncology is paid for, shrinking lumps. But in fact, the cancer is an oncogenetic program similar to a virus in which the virus will take over a cell and remain dormant for decades, then get activated for all kinds of reasons, and take over a cell and go on a joyride and crash the cell. And this is exactly what happens with cancers. Cancer is the result of an activation of what is called oncogenes that reside in all of our bodies. And if you think about cancer itself, or the evolution of cancer, the manifestation of cancer, as a river, every river has different tributaries. So when a person comes in, there's no direct cause-effect with cancer many times, although in some cases, of course, like for instance, after radiation exposure, there is cancer development and there are links. But it's very, very hard to say that river was caused by that. No. There's a headwater and then there are tributaries, and ultimately you have a river which is equivalent to a diagnosis. So complexity is one issue that is inherent in all biology. And our bodies are complex systems, and these complex systems have many vectors of stress, and like any cloud, might rain, might snow, might have thunder, might have lightning, might just be illuminated by the sun. A complex system inherently is unpredictable, but you can certainly tell by the color and by the stresses and by the look of the weather that predict that something's going to happen. In the case of cancer, when the lump does occur, it's already over 10 million cells large. So in fact, this started off with one cell, and the oncogenes with their software take over the normal function of a cell and go on a joyride and start reproducing and growing blood vessels and suppressing normal immune function and creating their own toxic ecosystem around themselves to support further growth. Now, when someone comes in and has a breast cancer or ovarian cancer or colon cancer, what is done is this. There's a symptom. The person goes in and gets a biopsy. They take a biopsy from the area where the growth is. They put a sample under a microscope and look under the microscope and say, aha, it looks like this and it comes from there, therefore we're going to look in the cookbook under cancer cells for colon, and according to the cookbook, we're going to decide what to do with this cancer. In other words, it's a statistical approach rather than a genetic analysis approach. It would be similar to seeing a ship out 3 miles off the coast in the Farallon Islands and saying, aha, there's a ship coming and it's this time of year and it's this time of day, and so we're going to look in the logbook and we're going to say, boats coming from the east this time of year have a 65% chance of being from China carrying rice. So therefore, it's a Chinese boat with rice, and treat it thusly. And that's the level of analysis done with cancer. But if you take out binoculars and you look out 3 miles and you say, oh my God, it's an Australian ship with kangaroos, you're going to treat that ship differently. And that would be going to the quantum level of actually where cancer occurs, at the oncogenetic quantum level. That kind of analysis is rarely done. So part of what I have incorporated since going to Germany in 2005 is a circulating tumor cell oncogenetic analysis. Now, what are circulating tumor cells? Whenever anyone has any adenoma or metastasizing potential cancer, there are always circulating cells in the body the rest of their life that are cancer stem cells or cancer clone cells. And whether or not the lump is shrunk or cut out or radiated or chemotherapied, and whether it ever manifests ever again, that person will, for the rest of their life, always have circulating tumor cells. Normal people, we're all fighting cancer, but we do not have circulating tumor cells unless there actually is a cancer present. So let's say a person is treated for a breast cancer, the lumpectomy, radiation, they have chemotherapy. They're sent home. Basically, the oncologist will say, okay, let's go home, hold your breath, and wait for the other shoe to drop. Well, that person is under the impression that they no longer have cancer, but they have this feeling, well, things are going to come back, perhaps. If I'm lucky, hold my breath, things will be fine. There are ways of testing to see how am I doing. Usually a blood test, if you're lucky, there's a CA 15-3 or a CA 27-29 in the case of breast cancer. There's a CA 125 for ovarian cancer. They're blood tests that are enzyme tests that are shadow dances with the cancer. They only reflect inflammation and at best give you a forewarning of future development. However, the technology exists and is way underused of taking a blood test and measuring the number of circulating tumor cells before a person has cancer to determine whether there's a cancer. During the course of the treatment, if they're going up, the treatment is not effective. If they're staying the same or going down, you've got at least a good chance that those cells are being affected in an adverse way and that you're winning. And after treatment, measuring circulating tumor cells to see if they're going up, there's a high possibility of return of the cancer, or going down or staying the same, status quo. And this is an actual measurement of cancer cells. And that is called a circulating tumor cell test. It is available, but it's poorly done in this country, which is why I use a lab in Europe. Harvard, MD Anderson, Sloan Kettering are using this test and have adjusted it so they get actual effective results for determining presence of cancer, effectiveness of treatment, and return of treatment, return for treatment if necessary. Once these cells have been isolated from a couple of tubes of blood, 20 billion cells, then they can be tested for their oncogenetic fingerprint. And that fingerprint tells you what the software is of that particular cancer, individualized. Not a statistical analysis from a logbook. Not a statistical analysis, but an actual individualized fingerprint of the circulating tumor cell population from that patient that allow you to determine what therapies are most effective, including not only cancer therapies like chemotherapy, targeted therapies like monoclonal antibodies, off-label use of various drugs to put an ankle weight on the cancer's ability to grow, but also nutrient therapies and how effective they are. So what I try to do with my patients is to first of all help them understand what they're dealing with, to gather information and make decisions out of information rather than out of fear. For certainly the worst thing that you can do is to make decisions out of fear in this particular field. The people that bother to find out and get information and think about it do much better than those that blindly go into treatment out of fear. And you know, I've had personal family experiences with cancer, friends with cancer, we all have. And so I've found over the years that more cancer patients are coming for me, not for treatment of cancer, because I don't treat cancer. In fact, I want to treat the whole person. I want to treat their immune system, I want to treat their organs of elimination, and I want to do containment for from future cancer growth. Oncology deals with one of those three things. Oncology deals with finding a lump, shrinking the lump, maintaining the patient. It does not deal with detox and elimination of things that cause cancer or promote cancer, and it does not deal with tonifying or strengthening the organs of elimination, the kidney, the liver, the lungs, the colon, the lymph, or the immune system. The future of oncology is biology. Biological therapies, not chemotherapy, are the future. And those therapies will be based upon stimulating the person's own inherent adaptive immune system to be able to respond to the presence and recognize the presence of cancer cells and eliminate them effectively, the way that a normal immune system would. So this leads me to something I've been working on, and I'm writing a book called Your Self-Healing Body and Removing the Things That Get in Its Way. And it came from 34 years of experience thinking about different systems and complex systems and applying two things to medicine: complexity theory and holography. That is, since we're complex systems, we're born with the complex system, but there's no owner's guide. This is what I would call an owner's guide for the human body. It's called what I call a holosystemic mandala. And what you see here is a mandala, and in the center of the mandala is cortisol. And cortisol is the body's ability to respond to any stress: emotional situational stress, pain, trauma, injury, inflammation, allergy, or glycemic imbalance. And then around the center, around cortisol, which is the adaptive survival hormone, are not organs but systems. And I won't go into all of them, but there are 12 systems around there, including the acid-base balance, adrenals, thyroid, methylation, focal blockages, hormones, cardiovascular system, glycemic insulin balance, immune system, brain biochemistry, gut ecology, and connective tissue and bones. You can see here that everything's in blue, and blue is the baby Buddha, the perfect health. Here you see some green, and green is the normal state of stress because stress is inherent in life. First breath to last, it's work. Yellow would be an acute stress, and here the cortisol's heating up and it's affecting the insulin metabolism and cardiovascular system, blood pressure going up, etc. Here is more stress, and here I've introduced orange, which is chronic. And here the guy's married, has 3 kids, and lost his job, more stress. And here the adrenals, thyroid, and methylation are being affected, and that's your starter motor, your voltage regulator, and your generator. In other words, you need the vitality to mount a healing response. For health is not just about what it is and where it is, it's about having the vitality to mount an adequate healing response. And that requires your adrenals, your thyroid, and something called methylation, which is mostly in the liver. At any rate, there you are, and here you see red. Red is a tipping point where the body actually can't self-regulate itself. This would be a chronic illness or a chronic autoimmune condition. And then violet, in this case, it's showing up in the cardiovascular system, is pathology. Now, this is the ground soil out of which emerges something we call health or disease. It is not that itself. It's actually looking at the vectors of stress and which systems are getting heated up and disrupted, and then The person goes to the hospital with a heart attack, he comes home, and you see the cardiovascular system's turned to red now, so he's stable, but look at all the other systems that are out. Not addressed, not considered necessarily. So, well, first of all, the human brain understands color very quickly, at least mine does, and most people I've met, that's true. And a lot of times when a doctor's looking at a patient and talking and looking at their notes, they've got to read through all these words to get to the essence of what's going on, and a lot of times just handle what's in front of them, but not always recollecting all the other things going on. So this is a colored note-taking system to understand the vectors of stress in a complex system. And so therefore, whether the doctor or the patient on the page is looking at this, both the patient and the doctor can understand the colorations here. And this, of course, would be changing, and over time, of course, everybody's trying to get back to that. I'm really passionate about talking about and understanding and explaining how health emerges not on the level, on our quantum level that we're used to talking about. My finger hurts, my head hurts, my hand hurts, my heart's in trouble, I have this, I have that. Actually, when I look at blood under a microscope and I show someone their blood cells, they understand that there is a quantum underneath our macro quantum here, the micro quantum, that without which we wouldn't be here. Those cells understand. How do they understand what to do? Because they have our hologram. In fact, from the subatomic quantum to the atomic quantum to the micron quantum to the meter quantum, our quantum, to the kilometer quantum to the parsec galactic quantum, each quantum is built upon the other. And so we are an emergent phenomenon built off of a smaller quantum. The way that I've talked about this in my book is graphic, the same way that the holosystemic mandala is a graphic way of demonstrating complexity in our body. I've taken Hubble deep space photography of far-off galaxies, and I've compared them with microphotography of the human blood crystallization patterns, and you cannot tell which is galactic and which is micron quantum, which is blood and which are galaxies, because they're both fractal patterns, and those fractal patterns exist in every quantum. It's just that it's harder to see the patterns when we're in our own quantum. Now, our ancestors were used to sitting around staring at things and fine-tuning their appreciation of patterns. A lot of times nowadays we'll look past those patterns. When we look through a telescope or when we look through a microscope, it's much easier to recognize patterns that are in nature. And those patterns are fractal, meaning the part reflects the whole and the whole reflects the part. And that exists at every quantum level, including our own, if we're careful enough observers. But looking at blood and looking at telescope photography, Hubble deep space photography, you actually do see fractal quantum patterns, and they look exactly the same. Whether it's the coastline of Italy from 3 miles in space, or whether it's the edge of a blood slide at micron level, there are similarities that are striking. So health emerges not just out of what we see in front of us. Health is emerging, or disease is emerging, out of quantum levels that are underneath us and that are the supporting structures out of which we are emerging. And that realization itself is enough whether the book was 2 pages. If getting that concept across is really important. When I was just getting out of graduate school in art in San Francisco in the 70s, there was a bunch of hippie physicists who had a holography, do-it-yourself holography warehouse in downtown San Francisco. And I went down, I took the course, and I brought little toys, and we set them up on an interferometer, which is a sand pit on tires so it doesn't move or vibrate. And we would take a laser beam and split the laser. One laser would go by mirrors to the photographic plate directly, called a reference beam, and the diffused laser would go through the little toys that I had set up and be an image beam. And the image beam would hit the photographic plate slightly different and smaller and slower than the reference beam. That creates a three-dimensional photograph called a hologram. And you can see it on your credit cards. You can see it in a hologram. Three-dimensional photograph, you can look around. Well, as it turns out, when I looked at that photographic plate, and in those days it was a laser photograph, so you couldn't see it in regular light, you'd shine a laser diffused through it, and you could see this image. And I wondered, what would happen if you took that beam of laser and just shone just a part of that photographic plate? How much of the image would you see? And I did it. And what I saw was the entire image, but with less detail. And what that means is that in nature, photons gather as much information as they can in every direction, especially coherent light, or light of all the same wave pattern like a laser. And the more photons you have, the more detail you have, but every photon contains the whole. The same is true in the body. Every aspect of the body contains a message of the entire body. When cells are floating, billions of cells are floating, those cells each contain information of the whole body, and the whole body understands the part, and the part the whole. So that's the way we're made, and when people say, how could that be? My answer is, how could it not be? Because we're a reflection of everything else in this universe, and this universe is complex and is holographic. So those are concepts that are really important, and understanding how do I treat cancer is akin to whack-a-mole. If you don't get underneath the whole thing and understand that the ecology of the body and the ability of the body to eliminate and the ability of the immune system to regulate abnormalities in cells, unless you get to there, you're only going to be holding your breath and waiting for the other shoe to drop. So I don't have all the answers, but I know that is a pathway to the answers, and science knows that too. Unfortunately, science is 10 to 15 years ahead of clinical medicine. The application of what is known is way behind what the actual biological sciences are saying, and the explosion in information on cell metabolism, cancer cell metabolism, cancer genetics, cancer epigenetics, downstream effects, circulating tumor cells. I wanted to say something about what are called cancer stem cells. This is really fascinating. I would recommend you go to Robert Weinberg, W-E-I-N-B-E-R-G, / cancer stem cells for a YouTube lecture by this eminent Harvard researcher in cancer. And what he is saying and what has been discovered is that if you take a cell from the breast, from the milk ducts of the breast, the mucosal cells, which would generate what are called adenocarcinoma, and you mutate the endothelial cells, which are neatly lined up inside of the colon and in the prostate and in the lungs and in the breast, and they don't travel, they line up like little soldiers, and you mutate those into cancer cells. And you take connective tissue from the breast, which is inherently mobile, called mesenchymal tissue, different cell line, and you mutate those cells from the breast into cancer cells. The endothelial cells will metastasize 1 out of 1,000,000. The mesenchymal cells will metastasize 1 out of 100. They're inherently mobile. What has been discovered is that there is a transitional cell in the breast and in all cancers that is called endothelial to mesenchymal transition cells. And this occurs in nature as well. It was considered impossible in the past, but in the neural tube of a fetus, the lining of the spinal cord, one of the first things to develop in a fetus, are endothelial cells. Now, they transition into these transitional mesenchymal cells. They mobilize and recoalesce as peripheral nerves in the fetus. So there's an example in normal nature of a cell, of an endothelial cell that doesn't move, transitioning into a transitional cell that is mobile, and then going back to the endothelial form as a peripheral nerve. The same strategy apparently is happening in adenocarcinoma or any type of cancer that spreads. So circulating tumor cells are not the same cell line as tumor cells. Not only that, but they do not respond to chemotherapy in the same way at all. Chemotherapy will kill off 90+% of the tumor cells, the endothelial cells, but the circulating tumor cells or mesenchymal transition cells respond only 30%. So in very real ways, using chemotherapy is training the essence of the cancer to be more aggressive, more resistant, and more likely to spread. That's why we need to have a very holographic and holistic way of approaching cancer and, very importantly, understanding what we're dealing with. Thank you.